Dr. Kirsten here, and I am a pediatric chiropractor, and there is something we see so commonly in our office, which is cases of plagiocephaly and torticollis in this office all the time. Now, there are 4 things that you need to know if you already have a child diagnosed with torticollis or plagiocephaly. The first thing is that we see with kiddos with these types of issues is that it's often missed early. And it doesn't become a diagnosis until it is super severe, which is very sad for us to watch. But what if we could have prevented this diagnosis in the first place? What if there are some early solutions that we can address this preventatively instead of reactively? Oftentimes, the first doctor that a parent takes their new baby to is a pediatrician, which are doctors that are trained in so many wonderful things. And sometimes they can look at certain things very generally compared to a specialist, for example, in that field. They don't necessarily have a super deep understanding about what we call the neurological spinal system or the neurospinal system, which includes the biomechanics and specifics of the neck and skull region and how it all interfaces with the cranial bones. So the key with plagiocephaly and torticollis is that even a little bit of misalignment or what we call subluxation or imbalance and in that body, especially in that first year of life, that's where all these things get missed. So even a little bit of misalignment to the developing nervous system, that developing baby has a ton of growth in the brain that happens within that first year of life. So this is where things get missed, and it's a huge period of development for your child. So you want to be looking for these things early and early signals for them. So sadly, often these misalignments in the upper neck and cranial region get missed for months or unnoticed until sometimes even a year. And then we're starting to talk about things like helmets, which no parent wants to have to do for their child. So that's the first thing you need to know when it comes to torticollis and plagiocephaly, is that we see hundreds of kids a week, and the ones that come in with these diagnoses were often missed early. That's the biggest thing. It's often missed by their pediatrician, and sadly, parents are coming to us at a loss since they are now having to consider using more interventions like a helmet for their baby, which is a ton of stress and a lot of work for their child as well. And socially and in the public, it's hard to, walk around with your child in a helmet and have to explain over and over again why that's happening for your baby. Now, the second thing you need to know about torticollis and plagiocephaly is that we see kids with this as a prior symptom in the history when we're talking to parents and we're asking them questions about their child's history. All these histories of the kiddos that are coming in with more sensory challenges, dysregulation, ADHD challenges, spectrum, and emotional struggles, we see a link to this almost all the time. They almost always have had either torticollis or more severely plagiocephaly in their history. And so they're coming to us at age 6 or 7, and 99% of the time we're seeing that they had torticollis as a young baby or toddler. And this also is correlated with upper neck restrictions and sometimes plagiocephaly as well. So this is where we start to connect the dots as pediatric chiropractors and connect structure to function. Poor structure early on creates challenges that if they go unaddressed from a neurospinal level, which is what we address, this can turn into bigger challenges and issues for kids later on. They don't just grow out of it. So we can do all the helmets, we can do the PT and all the superficial things to try and get things stretched out and balanced out when they're young. But if we don't address the root challenge, being a structural and neurological misalignment in this upper neck region and the cranial bones region, this will escalate into bigger issues later on, showing that they are still stuck in their nervous system or in a stuck mode. So this brings us to number 3. We love every single therapy that these kids have. So they're often coming to us already doing all these therapies, the PT, the OT, the helmets, the stretches, all the things. But there's one thing that we address as doctors of the nervous system that is the missing link usually with these kiddos that have kind of plateaued with these therapies. So the way that the body works from an inside-out perspective is the central nervous system sets the tone or the muscular tension of the body based off of the input it's receiving and the stress it is under. So most of the time, torticollis and plagiocephaly looks from the outside like a bone or a muscle problem. But if you go back to what is attached to the bone, And what is pulling it in the right or wrong direction, that is the muscle, which is actually controlled by the peripheral nerves, which stem from your central nervous system. So when we look deeper, most of these kids have a stressed out or hypertense nervous system, which is creating abnormal tension in the muscles that are pulling these bones out of place or out of alignment. And so that's the result that we're seeing, is there's flattening or preferences or just being stuck when they're little. So to finish off point number 3, we as nervous system focused pediatric chiropractors look to the nervous system, the root issue, to tell us where to focus our adjustments to make the most impact to calm things down from a neurological root level. So that brings us to number 4. The root cause comes from where? What we see in our office is it's a very stressful pregnancy. Perhaps there's abnormal presentation, like baby was breech, or there's extra stress on mom while she was pregnant. And most importantly, after this, we see a very stressful birth. So birth trauma is a huge thing with these kiddos. Oftentimes it's forceps, vacuum extraction, cesarean sections, inductions, twisting and pulling excessively on that head and neck region at birth. When there's excess stress and force put on that tiny upper neck area for that baby, that is where your brainstem and your central nervous system communicate. That's like the freeway for it to communicate to the rest of your body. So if there's more stress here, nothing's going to function correctly. It's going to be altered function and altered tone in the system. So kids with plagiocephaly and torticollis have an apparent misalignment and imbalance in this upper neck area, and we see that every single time in our office. This creates more tension in the muscles of the upper neck, restricting the neck motion and range of motion, and then interfering with those neurological milestones and much more later on. So it's not just a restriction issue. It starts as a restriction issue, but turns into more stress later on. So this is why if you're a parent of a baby where you're noticing more one-sided movements or preferences, favoring a side, one side versus the other, or anything one-sided, this should be a red flag to you. Make sure you get this checked out by a pediatric chiropractor that's well trained in balancing that left and right side and making sure there's balance in the body so that that baby is functioning and moving correctly, because movement is a window into what's happening in the brain. We don't want excess stress happening in this area, and if it's not released early, it can turn into bigger issues later on for these kiddos. And we see it time and time again in our office. So we try to be more preventative in making sure that they don't need those helmets or they don't need those extra therapies later on, that they're just stuck in this state of stress. So make sure that if your child is struggling with this, even one-sided motions as a baby, make sure you're getting that addressed with someone who's trained to work with babies and young kids as a nervous system focused chiropractor. And we will get you set up with one. Let us know if you have any questions, give our office a call, and we are happy to answer any questions that you might have. Thank you.